Report. I want to raise all of this with Dr. Devi Nampiaparampil, the physician who's guided us through these recommendations as they keep coming out, and now with schools doing all of this. You know, Doctor, I'm just wondering, they want to police the kids, especially in college campuses, don't congregate in bars, honor social distancing. It's almost inevitable, though, that when things reopen and they do gather, whether they're honoring that or not, that just the sheer number of new people gathering is itself going to lead to a spike in cases, right?
I agree with you. I mean, we know that social distancing makes a difference, but if you have large crowds, you have more spread. I think what we're going to see is over time, there will have to be more changes that become more cultural, not just legal changes. So, for example, if we think about historically, just different pandemics, for example, the plague, there were all kinds of changes that occurred after that. That's when bathing became more popular. Before that, we had sort of these public bathhouses. Those seemed to be more dangerous. Then there were changes where people just didn't bathe at all. And then over time, you started seeing people bathing and kind of using soaps. If you look at other things, even hand washing, for example, that wasn't common until a couple hundred years ago when they noticed that the reason that a lot of women died in childbirth was because the person who was delivering the baby had dirty hands. If they just washed their hands, then lives were saved. So I think, what we're going to see over time right now, it's a lot of conflict about personal rights, about just this startling change that people have to wear masks and kind of keep their distance. But I think even after coronavirus gets a little better, we might see some lasting changes in terms of how people look at infections or infection control.
I think it was the World Health Organization, Doctor, and you can correct me if I'm wrong, that said that children can be silent spreaders. This is the same organization that warned the whole, issue about masks and all. That could be around a while, years maybe. What do you think of that?
Well, I think that it's difficult because we're seeing some of the problems that come up with research in itself. So there's not always absolute answers. Sometimes we get a clue that something could be an issue, then we need to do larger studies. So for example, with the children being silent spreaders, I mean, there are some studies that show that children have higher viral loads. Now, sometimes that's the concentration of virus. Sometimes that correlates to how sick you are. Sometimes it correlates to how infectious you are, so how likely you are to get someone else sick. So with children having higher viral loads, that makes us more concerned that they could spread it more quickly. But on the other hand, when they look at larger studies, for example, it seems that kids are not transmitting it to adults as often as they would think, and kids tend to not be as sick as you would expect also. So it's a little bit confusing, but I think that the hardest part about coronavirus is this is not a situation where somebody has the answer and we just have to listen to that person and then everything will be solved. This is sort of like a trial and error situation where we have to have these small studies, then larger studies, and then work our way through it with a lot of different issues coming up related to the trial and error.
Doctor, this seems to be one of those rare type of viruses, unlike just a common flu or even a cold, that when people congregate, you hear a rapid spread, whether it's, college kids in a bar or those at a campground, or teammates rejoining play or practice, football, baseball. What is it about COVID-19 that multiplies like wildfire? What is it that has this unique feature?
I think some of the confusion has to do with we haven't totally nailed down how COVID is actually spreading. I mean, the theory right now, the working theory is that the main source of spread is these respiratory droplets. Now, whenever we talk, the way I like to explain it is just like my toddler who likes to blow bubbles. They're the bubbles that come out that are kind of invisible, carrying the virus, right? If they're large enough, then a mask will pretty much stop them. So even if people wear masks, even if they're close together, other things, for the most part, those bubbles are staying contained, maybe drop to the floor, maybe get contained in the mask. So the spread should be very slow. But on the other hand, let's say that we're wrong about that and they're much smaller droplets. So for example, things like perfume, smoke, where it's carried through the air, they're still droplets, but they're so tiny you can smell perfume from the other side of the room. Even if you wear a mask, you can still smell it, right? So it's the same idea that there are some cases that they found in the lab that seems to be the method of spread. China said there were some situations where they found the virus in the ventilation systems. So, from our point of view in the medical community, this is usually when someone is having a procedure in the ICU, if they're getting intubated, meaning a breathing tube is being put down, or a camera is being put in the lungs. But maybe there are other situations where that's happening also. So then just being in close contact with other people, even if you're wearing a mask, you could see more spread. But it's very confusing because even after all the protests and different things that we've seen, I would have thought the spread would be much greater than it was. So I think that the virus may be behaving in different ways in different situations.
Yeah, maybe it's very selective. Dr. Nampiaparampil, thank you very, very much. We're going to be monitoring this very, very closely. Again, with universities that are putting things off, colleges putting things off, and school systems putting it off, it is now fair to say that as the school year starts, I'm throwing in colleges, universities, primary, secondary schools, close to 60% of students across this entire country will not be starting in person. Stay with us.